Good afternoon and welcome. I am Pamela Ramcharan and I will be your host for this episode of our public education series on the Caribbean Parenting Digital Show. Now, through this platform, we have conversations that give helpful tips about how to be a better parent each day. And today's discussion, we will be continuing on World Mental Health Day, which is, of course, observed on October 10th every year and aims to raise awareness of mental health issues around the world and also to mobilize efforts in support of mental health. Now, here's a fact about mental health from the World Health Organization. It says less than half of the 139 countries that have mental health policies and plans report having these aligned with human rights conventions. And today's discussion is meant to help us understand mental health and its impact on adults, but also how it can be treated. Let's discuss further as we welcome Mr. Steve Bailey of Behavioural Consultancy Services Limited. He is also a professional training and coaching consultant. Mr. Bailey, thank you for taking time out of your day to join us this afternoon.
Thank you.
It is indeed a pleasure to have you. And even as we get right into our discussion, it's World Mental Health Day, and we're looking at mental health among adults. My question, Mr. Bailey, is mental health, the issues, are they prevalent among adults based on your experience? Of course, we seem to be having some technical difficulties, so we will have Mr. Bailey joining us shortly. Of course, World Mental Health Day, and we spoke about it, raising awareness of mental health. And this year's observation of mental health comes at a time when our daily lives have changed considerably as a result of the COVID-19 pandemic. The past months, of course, have brought many challenges for healthcare workers, providing care in difficult circumstances, going to work fearful of bringing COVID-19 home with them. So at this time, even as we speak a little about World Mental Health Day, we are glad again to have you back, Mr. Bailey. And we started off asking the question, mental health issues, are they prevalent among adults?
Yes, they are. In my practice, for instance, the vast majority of my clients are adults. I do see children. I see children from about 6 or 7, up into adulthood. But you find that the vast majority of my clients are adult males and females. I want to say that more than 90% of the clients are ladies. Not that they have more mental health issues, it's just that the men are sometimes, they feel that they shouldn't be coming to therapy, so that they cope with it in different kinds of ways, which may not be helpful at all. But yes, there are lots of mental health issues as we speak in the Caribbean, in Trinidad and Tobago, all around us. Yes.
All right. And you mentioned it being mostly ladies. Could it be again that, men usually tend to have that stronger persona based on, they are men, they are stronger. And is it a fear that you think they have
It's a
not
fear.
coming to see a therapist?
It is a fear. It is a fear. How are they going to explain to their guys at the bar that they're visiting a therapist, So it's a macho thing. So that's why they probably would not, unless the situation becomes dire, where they're on the verge of a breakdown or losing their relationship or their job or some sort, then they'll come. But generally, they won't come. They won't check in for a discussion on the general state of psychological well-being. No, that doesn't happen very much. No.
All right, and moving along with our discussion on mental health among adults, I want to ask another question as it relates to, you said about 90% of they that come to visit or to meet with you are women. Without, of course, giving information, because I know there is the confidentiality issue,
Yes.
what would be some of those issues or causes of those mental health issues or challenges that they face?
Well, lifestyle issues, I want to say sometimes, life is becoming more and more complex, more integrated in a negative way. You may find a lady may have more challenges than a man in that she has to do her, work in the home, parenting, she's working, and so on. And sometimes lots of, single moms, so it takes its toll. Sometimes you find that the man, although we encourage the male to be as present in the home as in parenting as the woman, generally they not that way. So you find that the lady might be more stressed. Also, the lady is much more open to a discussion on a psychological state than a man is. Because the lady may also be more in tune with her emotions. Sometimes it takes a long time for a man to decide, well, something is going wrong here. So that's part of the problem. Yeah.
All right. And, even as we continue our conversation, we're just going to take a little break here as we hear from our sponsor, Victoria Literacy Center.
Sure.
And as we continue our discussion, remember we are talking about mental health among adults, and we have our guest, Mr. Steve Bailey of Behavioral Consultancy Services Limited. And, we are definitely having a bit of technical difficulties, but I know that he is back with us. So welcome again, Mr. Bailey, as we continue our discussion. Of course, we're dealing with technology, and there are still hiccups in technology, but we will continue our discussion. And moving on from talking about the number of women as opposed to men that would seek some sort of help with regards to mental health issues. My next question, Mr. Bailey, is in terms of signs, because for persons who may not necessarily come to meet with you, to consult with you, what are some signs to indicate that there are indeed mental health issues? Okay, Mr. Bailey, I believe that your mic may be muted. Can you just check it for me? Are you hearing me, Mr. Bailey? All right, So again, having some technical difficulties, but our conversation on mental health among adults will continue shortly as Mr. Bailey joins us. And, we were talking about this year's World Mental Health Day, and we are dealing now with the COVID-19 pandemic, which is something that is affecting all around the world. And according to the World Health Organization, it says that the challenges that have come along with COVID-19, it actually lays out and has indicated for healthcare workers. We know they, of course, were the frontline workers. And again, we have Mr. Bailey, so we're going to just be joining him again. Mr. Bailey, can you hear us? Okay, we are having some audio issues. We are not able to hear you, Mr. Bailey. So there seems to be some audio issues that are taking place, even as we continue to sort that out. And dealing with World Mental Health Day in the context of COVID-19 and this pandemic, the World Health Organization. So we're still trying to sort out that technical issue, that audio problem. They laid out the healthcare workers saying that they provide care in difficult circumstances, going to work fearful of bringing COVID-19 home with them. For students who have been greatly impacted, they have had to adapt to taking classes from home with little contact with teachers and friends. And they are also anxious about their futures. For workers, on the other hand, their livelihoods are threatened. For the vast number of people caught in poverty or in fragile humanitarian settings with extremely limited protection from COVID-19, and for people with mental health conditions, many experiencing even greater social isolation than before. And the World Health Organization says this is to say nothing of managing the grief of losing a loved one, sometimes without being able to say goodbye. And that, of course, we have seen it time and time again happening with persons, even all across the world, where deaths have occurred due to the COVID-19 pandemic, and not even being able to get in touch or to communicate with relatives. So we have Mr. Bailey back on again. So we're going to try again to see if we are still having that audio issue. And I'm going to just bring him back on. Mr. Bailey, can you hear me? Okay, I am hearing you clearly, but I'm not able to hear you clearly, rather. So there still continues to be a technical issue with the audio. For whatever reason, there are some issues that continue. We are trying to sort that out, Mr. Bailey, and we're going to try again to see how we can get on with him. And even as we continue to talk about World Mental Health Day, we spoke about the consequences or the things that have happened due to the COVID-19 pandemic. We've had, and deaths keep being recorded all across the country, all across the world. And, not being able to say goodbye to a family member or to a friend. It also talks about the economic consequences of the pandemic are already being felt as companies let staff go in an effort to save their businesses, or indeed some have actually had to shut down completely. And given past experience of emergencies, the WHO says it is expected that the need for mental health and psychosocial support will substantially increase in the coming months and years. Investment in mental health programs at the national and international levels, which have already suffered from years of chronic underfunding, is now more important than it has ever been. And of course, the WHO says the goal of this year's World Mental Health Day campaign is increased investment in mental health. So again, we are trying to sort out that audio issue with Mr. Bailey. We're going to be just talking about mental health among adults and the prevalence. Of course, he is from Behavioural Consultancy Services Limited, and we're just looking again, remember, global, it's a global observance World Mental Health Day. And there are several reports, there are several statements that have been made on World Mental Health Day. And I'm just reading here from where the World Health Organization says the global challenge for movement on mental health kicks off as lack of investment in mental health leaves millions without access to service. So it's a global challenge. So lack of investment, the World Health Organization is saying, lack of investment in mental health leaves millions without access to service. So we continue to sort out our technical issues with Mr. Bailey and talking about the WHO, what it says. And I'm just going to be reading from a statement here. It's a joint news release and it's from the World Health Organization. It says a global social media challenge to get the world moving on mental health was launched. This actually launched during the week, the 7th of October. And it launched with a call for a massive scale up in investment in mental health. And the World Health Organization, rather, in collaboration with United for Global Mental Health and the World Federation for Mental Health, they encouraged people from all countries to support a global movement calling for greater investment in mental health. And even as we continue to read that release, I see Mr. Bailey's back with us. Mr. Bailey, are you hearing me? Okay. I am not hearing you. I realize that you are hearing, but we're having that audio issue. It's still continuing for whatever reason. But these are things that do happen. And even as we still try to sort out that issue, we do, we do appreciate Mr. Bailey being with us at this time. And even as we try to sort out the technical issues for those that are viewing, we definitely have to close off for now because we have those continuous audio issues taking place. All right. So I want you at this time to, thank you for joining us, an abridged version of the public education series on the Caribbean Parenting Digital Show. I want to also take this time. I know Mr. Bailey was trying to really get on to us. Mr. Bailey of Behavioral Consultancy Services Limited. And I want you to feel free to join us again at 5:30 p.m. as we discuss mental health and the elderly with Dr. Jennifer Rouse. So I am your host, Pamela Ramcharan. And until next time,